They say health is wealth. Worrisome, however, is that in spite of the globally recognized importance of this sector in Nigeria, the most populous nation and indeed largest economy in Africa, with its abundant human and material resources and large market, the health sector has remained seemingly neglected. It is even more disturbing that in the 21st century, when the rest of the world is strategizing and realigning for strong and sustainable economic expansion, the self-acclaimed giant of Africa is still battling with corruption, inadequate infrastructure, bad roads, among others. A focus on the healthcare sector today is a key player in the Health Maintenance Organization, the Managing Director of Healthcare International, in person of Mr. Tosin Awoshika. And a focus on the Nigerian Dental Association is the national president in person of Dr. Omoshibo Evening Eshikena. And looking at the harbour and traditional sector,
Chief Executive Officer and Founder, Quincy Harbour, Dr. Mrs. Quincy Sumbo Ayodele.
greater awareness to the man on the street for him to be able to understand that it's better for him to have a health plan. Because some of the costs, in fact, most of the health plans cost considerably lower than what people spend on their recharge cards on a monthly basis. And that's the message we're trying to sell out to people, for them to understand that when you have a health plan, it makes it easier for you. You know, it takes away the pressure. Unfortunately, a lot of times you have a lot of people, like I said at the beginning, running into the hospital only when those conditions have become very critical. Some of those things are things that could have been taken care of much earlier if they had access to healthcare and if they had been visiting the hospitals. There are people who have lived with some conditions for several years because they have been able to, maintain themselves properly, that way. So we're trying to reach out to as many people as possible and get them to understand that having a health plan is supposed to be as important as maybe carrying your mobile phone. We want to intensify efforts along that line. We're one of the HMOs on the Lagos State Health Scheme, and that is kicking off about now. Right now we're doing road shows, so we expect to carry, we expect to carry the message out there to the public that yes, there's a need for them to have health insurance plans. If you look at 10 organizations that have health plans today, about 8 are practically forcing the scheme on their staff. Because yes, they've seen it as the most effective way of taking care of the health of their workers. I'm talking about the corporate entities. Most of them have seen it as, look, this is the most effective way in which we can get people to have access to good quality healthcare. But most people would rather not. Because in this environment, more emphasis is placed on curative rather than preventive. Tell most people to do health checks. They would rather not. It is when they fall ill that they want to run to the hospital. Most people would go to the hospital only when that situation is very critical. And that is why, more often than not, visits to the hospitals are near emergencies. And in the civilized world, most of the times when people go into the hospital, they are called emergency room. That's what is almost like routine to us is emergency in a lot of places. Because people, I can bet if you walk down the road, 9, if you're supposed to have half a person, 9 persons out of 10 do not even know their health, vital health statistics, not to talk of having done some health checks and all of that. So that is the environment in which we're working in. So a greater number of the times, people going to the hospital are battling. And unfortunately too, in some cases, I'm not saying all, the providers are also not helping. Because yes, in a good number of times, when such people present in the hospitals and the providers want to treat, knowing that most of these people are under health plans and the like, they want to take maximum advantage. We've had to grapple with situations where, for instance, to find out whether someone's sugar level is high, a provider writes out about 6 tests, when maybe 1 or 2 could have given you the answer. Of course, they want to take maximum advantage. So those are the challenges that HMOs have to deal with. And because of that, a lot of people feel we're not doing as much as we could do. I know we can do better, but believe me, we're working in an environment which isn't very, very friendly. Look, let me say something. Let me give an example which I think would be easiest. One, we're called middlemen. A terminology I find very absurd, but good enough. Middlemen, because other than the NHIS, 100% of clients that visit hospitals have been sourced and marketed by HMOs. So please, where is the middleman? I am the one who has gone to look for these clients. I am passing them on to the hospital to receive care. That does not make me a middleman. The hospitals were there prior to my going to market these people. Why didn't the hospitals go there? Oftentimes, it starts with the HMO approaching the subscriber or the enrollee, who can be a company, a family, or an individual. We offer them our health plans, and they choose what is suitable for them. In the case of corporate entities, there are times when we actually have to, we call it customize, plans to suit whatever it is that they want to do. Now, when that is done, when they accept to come on the scheme, we go take them through a registration process. They choose a hospital, which is usually the first port of call for them. They choose a hospital, and after they choose the hospital, then we register them with the hospital. And when we register them with the hospital, then we move on from there, to pay what you call capitation. After they registered, we pay capitation to them, to the hospital. Capitation is a predetermined amount of, is a predetermined sum, which we pay on behalf of the enrollees, and irrespective of whether they go to the hospital or not. The idea behind this is to create a pool of funds within the hospital environment, and that makes it easy for anybody makes it easy for the providers to be able to provide care, because of this, going by the statistics or going by whatever has been done prior to now, actuarial studies, barely 30% of any given figure, number of persons visits the hospital. So
optometry is a primary eye care practice which is specialized in the treatment of eye diseases, minor eye diseases, prescription of glasses, training of the visually impaired to be able to perform their task. And also, majorly specialized again in oculary-surgery, which has to do with the customizing of artificial eyes. Because in ophthalmics, there has been a void in Nigeria not until 2011 when we stepped into the path of popular history, the field of popular history, to start customizing prostheses for those who have lost their eye due to an accident, due to a failed surgery, due to an infection, just to give them that cosmetic look and for them to be able to get back their self-esteem. Because a lot of people who have lost their eyes, even women who have lost their eyes due to domestic violence. I've had lots of women like that who have come in were battered by their husbands and they were actually losing their self-esteem. One of them actually almost committed suicide until she met us, and we are glad that we were able to satisfy her needs and she's doing very well. So this is also what we do. This is actually a void that we have filled in the ophthalmic sector. And we are so happy to have stepped into those shoes to fill that void. Well, there are lots of dangers. I always tell my patients that we live in a violent society. We pray violently, we talk violently, we act violently. I've had a patient who was just at a bus stop and he said some people were fighting and the purpose of bottle got into his eye. That was how he lost his eye. We also had a case where, fortunately, the patient was wearing glasses and was in church. During prayers, of course, you know how we pray as Christians. And this guy threw his fist at him. Thank God it was just his glasses that got broken. So that's why we also advise that because we live in a violent society, we advise that people wear protective eyewear, especially outdoors. Number two, it's not favorable here. We're looking at the sun. The sun damages the eye more than any other thing. Looking at cataracts, cataract is also another cause of blindness here in Nigeria. And most cataract cases are being caused by ultraviolet rays getting to the lens of the eye. But a lot of people do not know that. But because of the myth here in Nigeria that, wearing glasses is not a portion of a believer, or wearing glasses is not a portion of a true worshipper, it actually limits the use of optical devices to protect the eye. Possibly if that patient, had it been that patient who lost his eye that we had to make an artificial eyes for, was wearing glasses that particularly, there's every chance that the pebble or bottle wouldn't have gotten to his eye. So we have to emphasize more on eye protection. Our welders, do they wear protective goggles? They're supposed to wear protective goggles, but a lot of our welders do not wear protective goggles. And of course, when those sparks of fire get into their eyes, it melts the eye tissues. And that exposes that welder to loss of the eye, probably the shrunken eyeball, and that welder may need to come in for an artificial eyes. It's not advisable. But on the contrary, we have some errors or some other uses of contact lenses that is not just cosmetic. But cosmetically, it's not advisable, but of course, we all want to look good. Someone who is wearing glasses may want to wear contact lenses on our wedding day. I would not want to wear a plain contact lens, or want to wear something colorful to look different. So but we won't object to that. But because of the nature of our environment is dusty, getting contact lenses into the eyes, of course, will make that patient blink often. And that will cause some discomfort. We've had cases where patients wearing contact lenses come down with severe infections that have either made them lose vision in that eye, lose their cornea, that's the black part of the eye, or have made them even lose their eyeball entirely. But I'm not saying that contact lens is not good medically. Neither am I saying that it's out of place to still continue to do cosmetic contact lenses. Another challenge we have about contact lenses are also the kind of contact lenses. You see all these contact lenses that are being sold in shops that are not eye clinics. Those contact lenses are majorly fake. Especially when we look at the Freshwood brand. Just recently we found out that Freshwood has actually stopped producing contact lenses. So you see Freshwood contact lenses and solutions out there in the market. So where are they coming from? The main eye doctors that are reachable to everybody, at least within the locality of this clinic, we have other optometry practices around. So I would say no member of the public will say that he has not heard of an eye clinic or has never had an interaction with an eye doctor. Then I would say no, in the fact that I think some of my colleagues, probably the younger ones or the older ones like me, choose to be in the city. So what of the rural dwellers? Those who are staying in the hinterlands, those places where development have not gotten to, the rural communities. How much eye care can they access? Now this also comes to the government. What is the local government doing about primary eye care? I also appreciate the Lagos State government because the Lagos State government has done a lot in terms of primary eye care. And they were able to put in optometrists in each of those primary healthcare centers. These primary healthcare centers, of course, are the first point of call to the rural community. So if we have optometrists in every primary healthcare center in Nigeria and functioning with basic ophthalmic equipment, the ophthalmoscope, trial lens box, the retinoscope, I think, and the visual chart, I think they will do very well. This does not cost millions of naira to just access primary eye care. But the main thing is personnel. Are they properly distributed? Are they evenly distributed all over Nigeria? We're not just looking at the cities like Lagos, Abuja, Port Harcourt. Somebody who is in Lagos, Abuja, Port Harcourt and says he hasn't seen an eye clinic or hasn't had an interaction with an eye doctor, I would beg to disbelieve that. Because we are being very well concerning our PR to the general public.
And also professionals and key players in the traditional and herbal sector. Now, none other face than Dr. Mrs. Quincy Sumbo Ayodele, CEO founder of Quincy Herbal.
My current assessment on traditional medicine at the moment is such that the government is now ready. They are ready to develop traditional medicine practice, the practitioners and the products, by creating a full department in the Federal Ministry of Health by the federal government. So that shows that the government is ready. So, and then I'm also aware that the federal government of Nigeria is preparing a pharmacopoeia, a West African pharmacopoeia on herbal medicine in Nigeria. That's the second edition, of which I happen to be one of the members of the committee, writing the pharmacopoeia. So the government is ready. The practitioners used to be ready when we had the umbrella body in the name of Nancy MP in those days. And, there was disunity amongst the leadership of the umbrella body. And I'm sure the government is trying to look for ways and means of bringing qualified practitioners together again to be able to, provide effective traditional health practice in Nigeria. So I'm aware that they are working on that as well at the federal government level. And for the products, of course, practitioners have products in Nigeria that work. We have a lot of products that work in Nigeria. And as soon as they finish putting their papers together, putting the practitioners together, creating an umbrella body, and sorting out a lot of things, especially helping to pass the traditional medicine bill, then we'll be ready to take off. But right now, they are in the process of, they're upcoming. But I'm happy to let you know that the federal government is now ready, to develop African traditional medicine in Nigeria in compliance with the communique of WHO. Because I also happen to be an expert committee member of development of African traditional medicine at the WHO level. So we're waiting. Practitioners are ready too, but we're waiting for government to actually bring us together, form an umbrella body, and then start the process of regulation, standardization, the passing of traditional medicine bill, and then we can take off effectively and even push China out of the market.
Our healthcare system is dysfunctional, not just at the actual healthcare system, but from the foundation of the country all the way up is where the problem is. There's no running water for someone to even make safe drinking water. There's no possible water. There's no light for them to cook their food to make it clean. There's no enough money for them to buy soap, to wash their hands, especially when you have a young child. You're supposed to wash your hand every time you're handling that child. If not, you can pass infections to that child. That is also there. Then when they even have a sickness and they have to present to the hospital, we don't even have access to the hospital, we don't have access to the doctors, nurses, and we don't even have access to technology. So that is the main problem that is happening to us in Nigeria. For us to fix it, I think there needs to be a complete overhaul of the entire system of the country.
That is the perception. People run away from the dentist because they think everything about the dentist is extraction. But I like to say here that there's a lot more the dentist does. It's only when there's no early report to the dentist that will now result in the tooth getting badly broken down and will now bring about the initial fear of the person from visiting the dentist. So early visit to the dentist can bring about many more solutions that are different from extraction. We recommend that the average person visits the dentist twice a year, that is every 6 months. But for those who have some underlying medical conditions, we advise that they visit their dentist more frequently, especially when they notice any problem in the mouth. There's a lot of improvement in the awareness of oral health care in Nigeria as it is presently as compared to the past. People readily go to the dental clinic with a view of wanting to clean their teeth, unlike in the past. And in Nigeria, I must say that we are also doing fairly well with oral hygiene care. People brush once a day. Most people brush once a day. But we're trying to improve and advise that people have more behavioral change by adopting the habit of brushing twice daily. That is brushing in the morning and also before bedtime. So there's a lot of improvement presently. The enamel is the outer covering of the tooth, the first layer of the tooth. But after the layer of the tooth, we have other layers like the dentine and the pulp chamber that are a bit softer than the enamel. So enamel is quite strong, and it only takes a poor oral hygiene or poor oral health mouth care that brings about the destruction of enamel.